In the last class, we saw midbrain, right? We were seeing the midbrain. And we saw the posterior aspect and the anterior aspect of the midbrain. Posterior aspect having the colliculi, right? Superior colliculi, inferior colliculi, separated by a cruciform sulcus. Also, the superior medullary velum, which is bridging the superior cerebellar peduncles. Also, we saw the trochlear nerve, which is emerging from the posterior aspect, and this is the only cranial nerve that is emerging from the posterior aspect of the brainstem. This is a cross section which is taken at the level of upper part of the midbrain, where you can see some structures. Now, let's see the cavity of the midbrain. Probably that was not discussed with you. Here, this is the fourth ventricle. Fourth ventricle, when traced upwards, the fourth ventricle continues as a duct here, and that is called cerebral aqueduct. Cerebral aqueduct. So cerebral aqueduct is a cavity of the midbrain. You can see that there is a small cavity there, that is the cerebral aqueduct. We know that the fourth ventricle is a cavity, right? It continues below as the central canal of the spinal cord, whereas above it continues as cerebral aqueduct, okay, which is a cavity inside the midbrain. When you compare the size of the cerebral aqueduct and the fourth ventricle, you can see that the cerebral aqueduct is very small, right? Very small, right? Whereas the fourth ventricle is dilated, right? Dilated. So that difference you may make out. So when we take a cross section of midbrain, what we can see here is that this is the posterior and this is the anterior aspect. You can see it's like a bell, right? Bell-shaped structure. So mid section of the midbrain looks like a bell. Now the center of it here, you can see that there is a cerebral aqueduct. Surrounding that there is a gray matter. Okay, this is called periaqueductal gray matter. Periaqueductal gray matter, which can be seen surrounding the cerebral aqueduct. Now, we know that there are cranial nerves which are emerging from the midbrain. They were this one, trochlear nerve, right? And also one more nerve that also we saw, that is, which is that here, the oculomotor, right? Oculomotor nerve. So oculomotor nerve and the trochlear nerve, they are emerging at this level. Now, when the section is going onto the upper aspect of the midbrain, you can definitely see the oculomotor nerve emerging from it. So we are expecting the oculomotor nerve, and in this section, right? So I'm just rewinding the things so that you will remember properly. Look at this here. This is the nerve here, that is the oculomotor nerve, that is the cranial nerve 3, right? Oculomotor nerve is emerging from the nuclei of it, right? And this is the oculomotor nuclei, oculomotor nerve nuclei. So from which the nerve arises, and that goes anterior, that can be seen. Now, there are other structures like superior colliculus, because the section is at the posterior, at the upper level, so it is superior colliculus can be seen. But if the section was little lower, you can see the inferior colliculus. But here it is superior colliculus, right? And this part of the midbrain is called tectum. Tectum. The posterior part is called the tectum. Okay, I'll describe the parts of the midbrain in the next slide probably. This part of the midbrain is called crus cerebri. Crus cerebri. Okay, crus cerebri. Fine. And this area is called tegmentum. Tegmentum. Okay, so here three parts: crus cerebri, tegmentum, and the tectum, in which you can see different structures. Like crus cerebri, if you look at the crus cerebri, you can see different fibers which are running in this area. As you can see, frontopontine fibers, corticobulbar fibers, corticospinal fibers, occipito-parieto, temporopontine fibers. Okay, different type of fibers can be seen here. Now, frontopontine fibers are the fibers which are arising from the frontal lobe, reaching into the pons. Okay, frontopontine fibers. Okay. Similarly, corticobulbar fibers. These fibers are emerging from the cortex and it is reaching into the medulla oblongata. Okay, corticobulbar fibers. So, there are different type of fibers in this area. Anyway, and this structure is called substantia nigra. Substantia nigra. This area. Okay, substantia nigra. We'll talk about the substantia nigra in the coming slides. It produces some chemicals, substantia nigra. Then posterior to that, you can see a big round nucleus that's called red nucleus or red nucleus. It can be seen on either side, red nucleus. Then medial lemniscus can be seen here. Okay. Now, see, all these things are, it needs a lot of description, in fact, but that's what I'm saying. If you would like to have a discussion, we will do for that. We'll go for that. Otherwise, it is not required. Okay, at your level. So there are some different tracts, as you can see here, the medial lemniscus and also spinothalamic tract, trigeminothalamic tract, different tracts. Now, what happens is that all these are continuation from the spinal cord, or you have seen all these tracts or some of them in the medulla oblongata. As you go upwards, these fibers orient themselves in different ways. Like if you say medial lemniscus, now what is medial lemniscus? Medial lemniscus is actually the pathway that is related to the dorsal column pathway, or it is the dorsal column pathway. Dorsal column pathway, we have seen the second order neurons of dorsal column pathway. After sensory decussation, it continues as the medial lemniscus. So this is what is happening here. Spinothalamic tract. We have seen the spinothalamic tracts, right, which carries the pain, temperature, sensations. Trigeminothalamic tract. These are the tract which are taking sensation from the trigeminal nuclei into the cerebral cortex. So that is trigeminothalamic tract. So that a lot of tracts could be seen in this area. You can also see the reticular formation in the tegment. So let's consider a little detail of this is an overview of the midbrain, how it looks. Now let's see parts of the midbrain. So you can see here again a structure of the midbrain. When we examine a transverse section to the midbrain, we can make out some of the major subdivision. The tectum, let's see here, is a part posterior to aqueduct. So posterior to the cerebral aqueduct, there's an area of the midbrain that is tectum. Now each half of the midbrain, so if you make a line here, so it can be divided into two halves, right? So each half of it is called cerebral peduncle. So anterior to cerebral aqueduct, put a line here. This area is called cerebral peduncle. This area is called cerebral peduncle. Okay, so the midbrain in front of cerebral aqueduct, put a line at the center that will divide the midbrain into two halves. That's called cerebral peduncle. Now, when you look at each cerebral peduncle, so this is one cerebral peduncle. It is subdivided into crus cerebri, that is anteriorly. This part is crus cerebri, and substantia nigra in the middle. This is substantia nigra, and tegmentum posteriorly. So this is how the midbrain is divided. So first of all, behind the cerebral aqueduct, the posterior part of the midbrain is called tectum. Now, in front of cerebral aqueduct, if you divide this midbrain into two halves by a line, this half is called cerebral peduncle. Each cerebral peduncle is divided into three parts. Most anteriorly, crus cerebri, substantia nigra, then the tectum. So those are the major subdivision of the midbrain. And you have seen that there are different nuclei or different tracts which are related to the midbrain. Okay. Here you can see superior colliculus again, cerebral aqueduct. The lemnisci could be seen. Medial longitudinal fasciculus could be seen. Substantia nigra. Different fibers like temporopontine fibers. Oculomotor nucleus could be seen. Oculomotor nerve can be seen. Decussation of some fibers could be seen. This is called rubrospinal tract. These fibers, rubro means it's related to the red nucleus. So these fibers are arising from the red nucleus and it is going to the spinal cord. That's why it's called rubrospinal tract. Okay, so that's what. See, all these things, the sections. If you need an explanation, you can let me know. We will discuss about that. Okay, if you find that this is important or this is asked in the examination, any sections. Okay, please let me know. We will describe on that in detail. Okay. Otherwise, it's not required. That's why I'm not explaining much on this, because it takes a lot of time to explain all these things and it may not be required for you. That's why. But if it is asked in the examination and if you find that it is important, please let me know. Okay. Yeah. So otherwise, we are going to the next topic, that is cerebellum. So here you can see the cerebellum area, right? So we have seen that it is related to the posterior aspect of the pons and the medulla oblongata, and we have seen the cavity here. It's fourth ventricle. Here it is very clear that the fourth ventricle is moving upwards in the midbrain as cerebral aqueduct, right? And below as the central canal of the spinal cord. Yes, that's very clear in this. So this is the cerebellum, right? So cerebellum is also called the little brain, small brain. Okay. The cerebellum has got two hemispheres, right and left hemispheres, like your cerebral hemisphere. And this is what you can see, the inner aspect of the cerebellum. The outer aspect of the cerebellum, you can see a lot of transversely running of fibers, as you can see here, right? And inside that, you can see that there are gray matter, which is situated outside, and white matter. You can see here, white matter is inside the cerebellum. You can see it is like a tree, right? Like a tree. How a tree is branching, something like that, right? So this is called the arbor vitae. Arbor vitae. Okay, and you can see that the cerebellum, inside the cerebellum, there are some nuclei which are located. So remember the definition of the nuclei, the collection of nerve cell bodies inside the central nervous system. So inside the cerebellum, you may see or you will see some nuclei which are related to the cerebellum. That also you can see, and also you will see the cerebellar peduncles, right? The superior cerebellar peduncle connecting the cerebellum to the midbrain, middle cerebellar peduncle connecting the cerebellum to the pons, inferior cerebellar peduncle connecting cerebellum to the medulla oblongata. This also can be seen, and there are a lot of tracts which are running in this peduncles. And the cerebellum, main function of the cerebellum is maintaining the equilibrium, right? Maintaining the equilibrium and rhythmic activities, learning abilities. Those things are carried by the cerebellum. Okay, the location of the cerebellum would be somewhere here in this. You can see here. Am I audible? Am I audible? The cerebellum is located behind, or you can say below the tentorium cerebelli in the posterior cranial fossa. This is the tentorium cerebelli. So below that, you can see the cerebellar hemisphere. So in fact, you can say the occipital lobe of the brain is separated from the cerebellum by the tentorium cerebelli. Okay, this is what you can see here. You can see that this is occipital lobe, posterior part, right? Occipital lobe and the cerebellum. So in between that, we have the tentorium cerebelli. Tentorium cerebelli separates the occipital lobe from the cerebellum. The cerebellum occupies the posterior cranial fossa, this area, separated from the occipital lobe of the cerebral hemisphere by tentorium cerebelli. So tentorium cerebelli is between occipital lobe and the cerebellum. The cerebellum lies dorsal to the pons and the medulla, as you can see in this picture. Cerebellum is posterior to the pons and the medulla oblongata, from which it is separated by fourth ventricle. Fourth ventricle is a cavity that is lying between pons, medulla, and the cerebellum. The basic internal organization of the cerebellum is of a superficial cortex, which can be seen here, superficial cortex, overlying a dense core of white matter. So white matter here is very dense. Over to that, we have the gray matter. So this is the beginning of the cerebellum, beginning slide of the cerebellum, where we have seen that it is located in the posterior cranial fossa, separated from the occipital lobe of the cerebrum by tentorium cerebelli, which is a thickening, or which is a fold of the dura mater that we have already discussed before, right? And it is lying posterior to the pons medulla, separated by fourth ventricle. There is a cortex which is seen outside, and there is a white matter which is inside. The cerebellum receives information from sensory systems, the spinal cord, and other part of the brain, and then regulates motor movements. So as I mentioned before, it is going to regulate the motor movements of the body. The cerebellum coordinates voluntary movements such as posture, balance, coordination, and speech, resulting in smooth and balanced muscular activities. So this is the main function of the cerebellum, right? As I mentioned, this is going to coordinate the voluntary movements, the repetitive movements, okay, posture, balance, coordination, coordinated movements, the speech, okay, which will result in a smooth and balanced muscular activity. It's also important for learning motor behaviors like cycling, okay, like driving, swimming. Okay, these things are learned with the help of cerebellum, because these are repetitive activities. So once you practice, then you are going to be master of it. That's because of the help of cerebellum. So this is the structure. This is how it looks, the cerebellum. You can see the posterior aspect of the brain. You can see the cerebellum here, and this is how it looks. This is a superior view, posterior aspect and superior view, right? So this is a posterior aspect, anterior aspect, and this is superior view. So this is how it looks. The cerebellum consists of two large laterally located hemispheres, which are united by midline vermis. So between two cerebellar hemisphere, okay, the bridging structure is vermis. So vermis is bridging the two cerebellar hemisphere. The superior surface adjoins the tentorium cerebelli. Definitely, the superior surface is going to be related to the tentorium cerebelli, isn't it? Because between the occipital lobe and the cerebellum, we have the tentorium cerebelli. So when you look at the superior surface is covered by the tentorium cerebelli. So as I mentioned, the cerebellum has got two hemispheres connected by a vermis, which is located at the center. Right? And the superior aspect of the cerebellum is covered, or it is related to the tentorium cerebelli. As you can see here, this is the tentorium cerebelli. Inferior cerebellar surface lies against occipital stroma. Definitely, because this is the area where the cerebellum is going to get located. Right, cerebellum and the left cerebellar hemisphere, right? So this is the inferior surface, as you can see, this area. This is superior surface, this is inferior surface. Now this area is occupying this part. This is called the occipital stroma, the flat part of the occipital bone. That is the occipital stroma. Stroma means flat. Inferior surface shows a deep median notch called valliculae. So when you look at the inferior aspect, the lower part here, there is a depression that cannot be seen in this very clearly, but there's a depression could be made out. So this area, little below, there's a depression, a notch, median notch, that's called vallicula. So this area, you can see a vallicula. Okay, this diagram is not showing it properly, but you can imagine that this between the two cerebellar hemisphere inferiorly, there is a vallicula, a deep depression, which separates the right and left hemispheres. So that is exactly separating, or this is separating notch between right and left cerebellum, that's called vallicula. So this is how it is related. Here you can see this is related to the right cerebellar hemisphere, left cerebellar hemisphere. And this area you have the attachment of tentorium cerebelli, right? Yes. So this is what you can see, the cerebellum. The inferior surface is located in the occipital squama, and the deep notch below, that's called vallicula. Again, the external surface of the cerebellum can be seen. Each side vermis is separated from the cerebellar hemisphere by paramedian sulcus. So when you look at the vermis is the central area. The vermis is separated from the hemisphere. So this area, there's a sulcus that's called paramedian sulcus. On either side of the vermis, there's a sulcus that's called paramedian sulcus. Okay. Now, anterior and posterior cerebellar hemisphere extends beyond vermis and are separated by anterior and posterior cerebellar notch. Now, this is the anterior surface of the cerebellar hemisphere and posterior cerebellar hemisphere. Okay, posterior cerebellar hemisphere. So they are extending beyond the vermis, and they are separated by the cerebellar notch. They are getting separated by the anterior cerebellar notch and the posterior cerebellar notch. Okay, now these things are going to be very important now, because this is what you have to write when the cerebellum asks. You have to mention about the introduction and a little bit about the location of the cerebellum. These things will be important. Now, what I'm going to talk. There are 3 fissures and 3 lobes. So the cerebellum has got 3 fissures and 3 lobes. Now, what are the fissures? The first one, that is horizontal fissure. Look at this. This is the horizontal fissure. The horizontal fissure, you can see it starts from here. It surrounds the cerebellum in this way. So you can see here, laterally it is very visible, horizontal fissure, which separates the superior and inferior surfaces of the cerebellum. Now, see, this area is the superior surface of the cerebellum, right? Now, below that, there is another surface, that is inferior surface. Now look at this. This is superior surface, where you can see. Don't see this different colors and all. This thing you see, this is superior surface, and this is inferior surface. Now, these two are separated by a fissure. That fissure can be seen here in this area. It runs like this. You are not able to see here, but you can see here. It is there here a little bit. Yeah, horizontal fissure. Look at this here, inferior surface. You can see that there is a horizontal fissure. There's a horizontal fissure in this area. All right. So it separates the superior surface from inferior surface. So this is superior surface. Now, if you keep it in the opposite side, you can see the inferior surface of it, right? So both are separated by horizontal fissure. So that is the first fissure. So remember, there are 3 fissures and 3 lobes. So we are seeing the fissure now. So horizontal fissure is over. Then the primary fissure, or the fissure of prima, which is running transversely across the superior surface. So there is primary fissure that can be seen very clearly. This is primary fissure. Primary fissure. Okay. So primary fissure cannot be seen on the inferior surface, but superior surface you can see it. Then posterolateral fissure. Posterolateral fissure is seen in the inferior surface. Now, inferior surface, this area here, there is a fissure. Now you can see that there's a blue color structure here. That blue color structure here is called flocculus. Flocculus. I'll come to that. Flocculus. Okay. Now, flocculus is separated from the rest of the cerebellum by a fissure that's called posterolateral fissure. Okay, we will come to the lobes, then the fissures will be more clear. So there are 3 fissures that we have seen here. The horizontal fissure, which is separating superior surface from the inferior surface. Now, fissura prima, which is separating, or which is seen in the superior surface. It is separating something. I will talk about that. So it is seen on the superior surface. Now, the posterolateral fissure that is seen on the inferior surface, separating the flocculus, which is a part of the cerebellum, from the rest of the cerebellum. Right? Let's see. So this divides the cerebellum into three lobes. Okay. Now, how it is divided into three lobes? Let's see that. Part anterior to the primary fissure is called anterior lobe. So we have seen the primary fissure. Anterior to that, this area is called anterior lobe. So this pink color structure represented here is the anterior lobe. Remember, it is seen anterior to the primary fissure or fissura prima. Part between two fissures, that's called posterior lobe. So between the primary fissure and the posterolateral fissure. So remember, posterolateral fissure is seen in the inferior surface, and fissura prima is seen on the superior surface. So between this and this, whatever part is coming here, right? And that's called the posterior lobe of the cerebellum. Okay. Now, remaining part, that is this part, is called flocculonodular lobe. That is the part of the cerebellum that is separated from the cerebellum by posterolateral fissure. And this part is called flocculonodular lobe, which can be represented here as the blue color, which is represented as blue color. So what we have understood from here, that there are three fissures. In the three fissure, there is primary fissure, horizontal fissure, and posterolateral fissure. Now, primary fissure, anterior to this area, anterior to the primary fissure, this area is called anterior lobe. Between primary fissure and the posterolateral fissure, the whole area, the main chunk of the cerebellum is the posterior lobe, right? Whereas a small part of the cerebellum that is separated from the posterolateral fissure, or separated by the posterolateral fissure from the rest of the cerebellum, is called flocculonodular lobe. That can be seen. So basically, the two fissures are separating the cerebellum into different lobes. They are the primary fissure and the posterolateral fissure. What about the horizontal fissure? Horizontal fissure is nothing to do with the division of the cerebellum. Horizontal fissure, what it does, it is just separating the superior surface from the inferior surface. That's it. So that you should keep in mind. The horizontal fissure is not separating the lobes. It is separating the superior surface from the inferior surface. It is seen in this area like this. The horizontal fissure. Now, anterior and the posterior lobe together, the anterior lobe and the remaining part of the cerebellum, that is posterior lobe majority, but there is a small part that is left out, that is flocculonodular lobe. Okay, that is not posterior lobe, it is separate lobe actually, right? So the anterior lobe and the posterior lobe together, call it as corpus cerebelli, because that is forming the main part of the cerebellum. Now, one more thing I'll tell you here in this, that we have seen the different divisions of the cerebellum. That we have seen the anterior lobe, right? Then the posterior lobe, anterior lobe and posterior lobe is separated by the primary fissure, whereas the posterior lobe is separated from the flocculonodular lobe by posterolateral fissure that we have seen. And there is a horizontal fissure that is separating the superior surface from the inferior surface. Remember, it has nothing to do with the division of the cerebellum. Which fissure? Horizontal fissure. Okay, try to remember that. Now, when we see the cerebellum here, you can also see the vermis here, right? The vermis. The vermis is also divided actually. The vermis is also divided into different parts. So how can we divide that? The vermis, the superior surface of the vermis, this is the inferior surface of the vermis. So this is also divided according to the lobe. Look at this here. This is the anterior lobe. So anterior lobe, whichever part of the vermis that is coming into the anterior lobe, that is belonging to the anterior lobe. Whereas the part of the vermis that is belonging to the posterior lobe, that is belonging to the posterior lobe of the cerebellum. Even the flocculonodular lobe, it also has a part of the cerebellum, right? A part of the vermis, I'm sorry. The flocculonodular lobe also has the vermis. So what do you mean by that? So here the vermis is also divided according to the division of the cerebellum. That means there is a part of vermis belonging to the anterior lobe, part of the vermis belonging to the posterior lobe, part of the vermis belonging to the flocculonodular lobe. But again, there's a small division which happens inside the vermis. That is what is written here. You don't have to worry about these terms, but at least know that the vermis is divided in this way. So from above downwards, if you look at the vermis, it is divided into in the anterior lobe, right? So there's a vermis belonging to the anterior lobe, this area. Part of the vermis belonging to the posterior lobe up to here. Part of the vermis that is belonging to the flocculonodular lobe. That's a gross division, but inside that again there's a division. So when you look at the division of it, there is lingula, central lobule, then culmen. This is the division in the anterior lobe, the vermis. Then in the posterior lobe, there is second division like declive, folium, tuber, pyramid, uvula. And the last part that is belonging to the flocculonodular lobe, this part is called nodule. Okay, so you don't have to break your head for remembering all these things, but at least know that vermis is divided in this way. Now coming to the white matter of the cerebellum. So this can be seen very clearly, the white matter here, and white matter is covered by the gray matter, right? So this is a section of the cerebellum. Okay, you can see here the brainstem can be seen here, the midbrain area can be seen here. This is the pons. Okay, so a section is taken, all right, and you can see the structure of the cerebellum. So this is the coronal section of the cerebellum. Okay, anterior part, and this is the posterior part, right? Fine. So anteriorly you can see the brainstem, right? Yes. So there's a small amount of white matter in the vermis. So when you look at the vermis, this is the vermis. In the vermis also you may expect a little bit of white matter. So I think you can see you can get the orientation. This is the right cerebellar hemisphere, left cerebellar hemisphere. Okay, and this is the pons, and below it will be the middle oblongata. Fine. So there's a large amount of white matter in each cerebellar hemisphere. Look at the white matter in the cerebellum. It is in a large amount, right? In a large amount, as you can see there. And it's closely resembling trunk and branches of the tree, right? It looks like a branching, trunk and branching of the tree, right? And this is termed as arbor vitae. So this branching pattern of the white matter here is called the arbor vitae. So arbor vitae represents the white matter of the cerebellum. Okay, so the cerebellum can be seen here. It's a coronal section where you can see the lot of white matter inside the cerebellum, right? You can also see the vermis. Vermis has a little bit of white matter, whereas the cerebellar hemisphere has a lot of white matter in it, which is surrounded by the cortex. Now, this is the inner aspect of the cerebellum. It's a diagrammatic representation. Now, most of the gray matter is arranged as a thin layer covering central core of white matter, that is the cerebellar cortex. So the cerebellum, outside the cerebellum, there is a gray matter. I mean, the outer aspect of the cerebellum, there is a gray matter that is called the cerebellar cortex. Okay, that represents the cerebellar cortex. And there are cerebellar nuclei inside, as I mentioned before, that in this is the white matter. Inside the white matter, inside this, you will see some nuclei. You can see carefully if you look at this there is a small change of color here, as you can see there, right? This area, and that represents the deep cerebellar nuclei. And these nuclei are 4: dentate nucleus. Center of each cerebellar hemisphere resembles crumbled pearls. Hilum is facing medially. So this is the nucleus here. That's called dentate nucleus. This is the most lateral nucleus. You can see it looks like a crumbled pulse, and there's a hilum. There's an opening here, hilum, and that is facing medially. Hilum is facing medially. So this represents one nucleus, that is dentate nucleus. Then medial to that there is emboliform nucleus, then globose nucleus, then the vestigial nucleus. So there are 4 nucleus. Okay, 4 nucleus on each side. Okay, so there's lateral to medial. We have dentate nucleus. Then you have emboliform nucleus, globose nucleus. Then you have vestigial nucleus. Now, vestigial nucleus is seen in the anterior part of superior vermis. That's the location of the vestigial nucleus. So whatever it is, there are 4 nucleus on each side of the cerebellar hemisphere, or inside the cerebellum. You will see the deeply located nuclei. And what are nuclei? They are the collection of nerve cell bodies inside the central nervous system.